Breast cancer is a disease that will eventually touch all of our lives, either directly or through someone we love. And we're fortunate that there are so many effective treatments available, but the reality is to get the appropriate treatment at the right time requires to really understand the extent of the disease, and there are still remarkable challenges to accurately imaging breast cancer. This is X-ray digital mammography of a woman with a bit of dense tissue, heterogeneously dense breasts, and you can see how identifying that the cancer is even present, let alone trying to determine how large it is incredibly difficult. And there's physics underneath this. The X-rays that are being used to take this image do a great job of contrasting fatty breast tissue and tumor, but are really physically unable to distinguish between tumors and dense breast tissue. Now contrast that with what a Radialis PET image looks like of the same patient. Immediately you're able to detect that there is cancer, you're able to see the size of the malignant mass, we can quantify the excess metabolism that we're getting in this tumor, and we can differentiate it from the benign mass that's just above it. Dense breast tissue is a known problem with breast imaging. It's regulated to be reported to women in increasing jurisdictions around the world. And half of women have either heterogeneously or extremely dense breast. When extremely dense breast, X-ray mammography is no longer really a useful technology at all for detecting breast cancer. The most commonly used alternative is ultrasound, and it's handheld and extremely dependent on the skill of the operator that's taking that image. There are other techniques like MRI or contrast-enhanced mammography, which have high sensitivity for breast cancer, but bring along a lot of false positive findings, and especially when you're in the treatment pathway, introduce additional delay and additional confusion in terms of what is the appropriate treatment for this woman. So we introduced the Radialis PET Imager. This is high-definition, organ-targeted PET for the breast. Very easy to deploy, rolls into an existing imaging suite. It's about 3 feet by 6 feet and 4 feet tall. You sit at it. The woman is in positions that are very similar to mammography, but without the extremely painful breast compression that's necessary for X-ray mammography. And very importantly, although it has extremely high sensitivity and excellent resolution, it also has very low false negatives. So what you're seeing is cancer, and all that you're seeing is cancer. Fundamentally, PET is a modality where you inject a radio tracer. The most common one is a glucose analog. So things that are using a lot of glucose, those cells take it up into the cell, and it's held there until it decays and emits a signal that our sensors can detect. And inside our sensors, uniquely, we have 2 planar sensors that are edge-to-edge, high-definition crystals that are the foundation of a whole series of additional innovations in electronics and software that give us the excellent image quality that we're able to show. Importantly, we have a level of generative neural networks that we're adding to this work to really optimize the quality of the image for the extent of disease, for the decision-making that needs to be done. This is an example, again, of one of our images, and contrasting with both the digital mammography, where you see again that dense breast tissue is really obscuring the cancer, and the incredible challenge that MRI is bringing to this case. So being able to determine what to do with this contralateral breast, which is clear of malignancy, is something that could really complicates the treatment for this patient. And there's a reluctance on the part of many surgeons to introduce too many of these MRI images to the workflow because of this real impact on the pace of patient care that it has. These results were published in our first clinical paper about a year ago, where we're able to show very high sensitivity as well as these low false positives, and being able to use a low dose. So because we are very sensitive to radio tracer, we're also able to operate with down to 1/10 the standard radio tracer dose. And this is what that means in terms of resolution. So if you're looking at a traditional PET CT, which is available in the sites that we're targeting, you really get a resolution that's not appropriate to be used for surgical planning. We've got an extra level of detail in these images that opens up applications that are not being used right now for PET CT. But we are applicable at different points in the cancer journey, be it in a very low dose capacity around detection, all the way through difficulty in diagnosing problematic cases. surgical planning, surveillance, and monitoring. And we are focusing on this planning piece, partially because it is where this PET is currently reimbursed in breast cancer, and also because it's where the deficiencies of the current imaging are most acutely felt in terms of treatment delivery. There is a significant number of PET sites already in the US. If you just think about our target market being extending the capability of sites that have already invested in nuclear medicine to be able to do this type of extraordinary imaging, that's already a fantastic opportunity for us. But then we do see this easier to deploy, lower dose capacity, pushing PET into places where it is not already. And there are 15,000 breast imaging centers across the country as well. We are an FDA-cleared device. We had the benefit of a very clear guidance from FDA about how to evaluate PET imaging for quality. And it means that we had this clearance actually in advance of our first clinical publication, which came out just a year ago, and where we were able to present our results and were greeted as well with a press release from the Radiological Society of North America that reinforced the transformative potential of this technology. We are now looking at our demonstration sites and our lead sites to look at these different types of patient cases where there's an extraordinary ability to advance care, whether that be through the imaging following neoadjuvant chemotherapy before surgery, where MRI can have difficulty distinguishing between scar tissue and active tumor, and invasive lobular breast cancer, where these slow-growing tumors are very difficult to characterize in all modalities, but there are new imaging agents for PET in particular that are very promising to be able to accurately image these patients, as well as women that are getting MRIs before surgery just because they have dense breasts and the surgeons know that the existing imaging that's coming with them is not accurate enough. We also have additional studies that are externally funded that are, because we are a platform technology, looking at the application of our device to Alzheimer's disease imaging as well as prostate cancer imaging. It's a very exciting time to be in this spot and talking about the launch of their system into the US market. We are building a sales and marketing team with past success, selling into breast surgeons. And I really appreciate your time today, spending some time listening to the Radialis story. I invite you to follow us on LinkedIn and be part of this next chapter of our community that's transforming the care of breast cancer.